Ecuador is now one of the worst-hit countries in South America. Officially, just 242 people have died there from coronavirus, but testing is still limited. And even the president has admitted that the actual figure is much higher, with hundreds dying at home on a daily basis. And in many cases, relatives have nowhere to bury their loved ones.
I came here to look for my dead relative with all the papers. They can't find the body. 1 day, 2 days, 3 days, 4 days, 5 days, and they can't find it. I'm sleeping here outside the building. I have fever. I'm taking paracetamol. My bones hurt. And all that because I want to bury my mother-in-law.
They believe they do good donating those things, but they're worthless. They're worthless because they burst open. When our relatives' bodies are kept long in there, the cardboard coffin bursts open. They get wet.
When cardboard gets wet, what happens? It disintegrates, doesn't it? Imagine transporting the corpse and it starts raining. It will disintegrate.
Hospitals across Ecuador are unable to cope with the influx of COVID-19 patients. Many people have been refused treatment and died at home. We spoke to a doctor in Ecuador who asked to remain anonymous. He said that dozens of medics have also died.
We see shortages in all pharmacies, both public and private, hospitals where there are not enough beds, no ventilation devices, key to saving lives. Unfortunately, we often had to wait for one patient to die, to give another his bed and breathing apparatus. More than 40 health workers have died in the pandemic, doctors and nurses. This is hidden from the public. It is important to understand that medical personnel cannot work in such conditions. So, for example, on Friday, a hospital in Guayaquil had to be closed, as there was simply no protective equipment. The situation with abandoned, decaying bodies will cause this pandemic to worsen due to diseases caused by the decomposition of corpses. If I could contact the WHO and the Pan American Health Organization, I would ask them to intervene in Ecuador and provide the assistance that the city of Guayaquil needs.
We heard from Ronnie Aliga Santos, an official in Ecuador's Guayas province, and Quinto Lucas, a former deputy foreign minister. They both think that Ecuador was completely unprepared for the pandemic.
No one was ready for coronavirus, but the government should be able to respond to a possible outbreak of the disease that started as an epidemic, then became a pandemic. It is obvious that the public health system must respond. Unfortunately, many of the hospitals built during the 10 years of the civil revolution were almost abandoned, and many doctors and health workers were laid off. Therefore, it turned out to be difficult to confront this kind of situation without hospitals and doctors, and in addition, the presidential administration has demonstrated its inability to act. The reality is that none of the measures that the government took worked. Since the start, the government has acted in accordance with how it described developments, but it was lying, reporting no deaths, while on the streets lay the bodies of dozens of dead people. Obviously, when a government lies to itself, its response cannot be adequate.
In fact, the situation in Ecuador is now disastrous. The reason for this is that our healthcare system was almost destroyed. Key posts were assigned to people who did not have enough training to ensure the functioning of this system. Bodies on the streets that no one removes. No established procedure for the collection of bodies. They invent some kind of proprietary protocol, according to which you have to wait several hours before picking up the body. But the citizens of Ecuador do not deserve such a careless, negligent attitude on the part of the officials who now stand at the head of the Ministry of Health. We observe a careless attitude on the part of the government, which was created to protect the interests of those in power, the financial elite. In areas of the province of Guayas, where the wealthiest segments of the population live, doctors come to patients' houses, while ordinary people call 911 in the hope that someone will answer them and explain something, but no one will answer them. People wait several days for them to do the test, and no one cares about them.